Here with us now, Republican Governor of Minnesota, Governor Tim Pawlenty, joining the show this morning.
Governor, thanks so much for being with us. Let's talk about the speech. And if you're talking about the speech, there's only one thing to talk about. Joe Wilson. Joe Wilson said the president lied. Did the president lie about illegal immigration?
Well, I think, Joe, when you have people saying the bill shouldn't cover illegal immigrants and one side saying it doesn't, one side saying it might, there's an easy way to address that, and that is just to say specifically what you mean in the bill. And the fact that they refuse to do it causes concerns. And as you know, on a practical level, in Minnesota and other states, we already have laws that say you can't provide certain services to illegal immigrants, but as individuals present themselves to the place of the service, if nobody asks, it becomes irrelevant because everybody gets the service anyhow.
Does Joe Wilson owe the president an apology? Should he go on the House floor and apologize for his intemperate remark?
His comments and behavior were inappropriate. The president addressing a joint session of the Congress is a place where decorum should be afforded the president, respect to the office. We should have people clapping or remaining silent, but we shouldn't have people yelling out and heckling him. Those were inappropriate comments, and he does owe the president an apology for his behavior.
We were concerned during the speech when the talk about death panels came up. The president said it wasn't true. Democrats stood up and applauded. Democrats remained seated. There's nothing in any of these bills that would... Republicans, I'm sorry, that would, quote, pull the plug on Granny, is there?
Well, as you've been talking about all morning, we have a democracy, and a democracy depends on an informed citizenry. The facts matter. Here are the facts. You did have in an earlier version of the bill a provision that said the federal government would encourage and incentivize end-of-life counseling. That concerned people to have the federal government involved in that, so it's a legitimate question. And even if that is removed, there's concerns that this thing is going to be so expensive, they're not going to be able to afford all that's promised, and somebody's going to have to make a decision to cut back, and people are concerned that if the federal government does that, have them rationing care, that's a real problem. And so those are not irrational concerns based on those facts. Now,
but you know, there are no death panels here, though. Counseling is one thing. Having three people lining up saying, Granny dies, Grandpa lives, that's quite another. You can't get there from here.
Well, what happens, Joe, what you call it or label it, but I think the facts are these. If you have a system like the United Kingdom where their breast cancer survival rates...
We don't, Governor. With all due respect, this does not give us a system like the United Kingdom. I'm talking specifically about this bill. How does this bill get us to, quote, death panels? You don't believe it does, do you?
Joe, what if it becomes so expensive and the trajectory of it is even close to what's being predicted 10 years out, that they can no longer afford all that they promised and somebody has to scale back the care, and the federal government is now empowered to do that. And if you look at examples around the world where that takes place, there are concerns about care being cut back by a federal government institution, and we can have a legitimate debate about whether that's good or not. I don't think it is.
Governor, what in this bill, though, let's be specific, what in this bill leads us to that position, gives a bureaucrat that power 10 years from now to make that decision? I know we're going to have to make excruciating decisions on health care. You've talked about it before over the next decade, because we run out of money in this country. But what in this bill specifically, what provision of this bill specifically would lead anybody to rationally believe that a death panel might emerge in a decade, based on this legislation?
Joe, there is nothing in the legislation that directly says that. It's the indirect concerns that I'm trying to articulate that I think are at least worth raising.
All right, Pat Buchanan.
Governor, let me ask you, this August we had a number of these very boisterous, raucous, confrontational meetings, town hall meetings with political leaders, congressmen, senators, and some of them really got pretty rough. Do you think on balance those town hall meetings, rough as they were good for the Republican Party, or do you agree with, say, Senator Reid, who said they were evil mongers, and others said a lot of these folks are really racist, confrontational? Were they good or bad for the Republican Party?
Well, I think they were good for the country and good for the party in the sense that those were the voices and sounds and passions of democracy at work. And again, we need to have a debate that's rational, that is informed, and otherwise we can't have a functioning democracy. But a little passion, a little energy is a good thing. A lot of it is a good thing. We just need to make sure that the information being conveyed is accurate and not hysterical.
Mike Barnicle.
Mike Barnicle.
Hey, Governor, I'm in a benevolent mood this morning, so I'm going to give you a shot at a redo here. I think I just heard you say in talking with Joe, that you fear that in 10 years, that's a pretty snap period of time, and it'll come very quickly, that in 10 years, because of lack of funds or shortage of funds, we might have government bureaucrats looking at me, telling me I gotta die. Do you really think that might happen?
Well, we do know this, Mike, and let's just be clear. The facts matter. In places like Canada, like the United Kingdom, they do prioritize what procedures get done in what order based on health conditions or age or similar measurements, and there's waiting lists for things. And so it is not irrational to say if this thing becomes so unaffordable and you put the federal government in charge of it, somebody is going to have to limit either its costs or the volumes of procedures. And if that somebody is the federal government, that concerns people. That is not a crazy idea. Now, does the bill say there's death panels? No. Does the bill say that somebody's actually going to, say you have to live or die? No. But the indirect concerns that I'm raising and others have raised are not irrational. So we can have an informed, reasonable debate about that without one side or the other just calling each other names.
Hey, Governor, let's talk about, I think, the issue that's going to be key for President Obama if he's going to pass this bill, and that is the cost of it. I've looked at these numbers. I've heard him talking about waste, fraud, and abuse, claiming that's going to pay for 2/3 of this bill. That's just not going to happen. How does the president end up paying for this bill over the next 10 years?
Well, those numbers, as you know, and you just said, are a complete crock. Nobody believes them. You don't believe them. I don't even think the president's administration fully believes them. They're not going to get the money out of waste, fraud, and abuse. So what they're going to do is either raise taxes or cut services. And it leads right back into the discussion that we had just a moment ago.
All right, Governor Pawlenty, thank you very much for being on the show this morning.
Hey, Governor, you ever in New York?
Yes, so once in a while.
Well, when you are, come on set, and if Barnacle's in a malicious mood, we'll sit you next to me.
We'll drop the puck. He's a hockey guy.
Is he a hockey guy?
Yeah.
Governor
Absolutely.
Governor's Pat O'Brien. I'm from South Dakota, but I fish up in Mantrap Lake up there in the state. It's a fantastic place to fish.
Very nice.
That's outstanding. Well, I'd love to be with the benevolent Barnacle.
It doesn't exist.
Put that on a bumper sticker, the benevolent Barnacle.
Hey,
Thank you, Governor,
Kiss his
so
ring.
much.
We'll kiss his ring. All right.
Oh, very nice.